Well, I'd finished a morning clinic. It was a pretty busy clinic, and I was coming home for a 2 o'clock meeting. And then for some reason, I just had this recollection that my hand was in the refrigerator. And I said, well, if I just drop my hand, I can get the cheese that I want. And I dropped my hand and got the cheese. And I was doing something else, and I go, wait a second, why am I having to engineer this? And I go, well, that doesn't seem right. As I was speaking to my children, who happened to be home at the time, I could hear the slurred speech. And then I knew we had a problem. And at that time, they called my wife, who was at the hospital, and she came back to see me, and she said, well, let's sit down for a second. And when I sat down, she goes, well, we're going to go to the hospital.
So I remember receiving notification that he was on his way. And so I remember going down to check with the team, make sure that they knew as well. And this is one of those times where you're kind of thankful when communication almost seems simultaneous, because sure enough, they had already received a call as well. They'd already prepped a room, already decided where he was going. Provider was aware.
Since my stroke symptoms were not classic symptoms, I was very fortunate that the team is strong enough to consider an additional piece of information, which we decided to move toward MR imaging. And that MR imaging gave us a more definitive answer. And once we had a higher confidence, they actually instilled my thrombolytic inside the MR tube.
Most of my interactions with Dr. Thornbury that day was facilitating movement, was assisting the nurses with anything they needed to just speed up the process, to allow them to free up their hands, to make calls, to grab the medicines, to do other things.
In my particular case, the partner hospital of TriStar had an immediate conversation with our neurologist. It's a neurologist dedicated to stroke and stroke care. Our clinicians are on a first name basis with those team members, and we practiced over and over again, not only under true clinical cases, but in the years beforehand, mediating that type of communication. The communication is such that with certain levels of patients, we want to try to advance them for their own safety to the level of care once they're stabilized. And those arrangements had been made at the time of my diagnosis. I left the MR tube and I went directly to the air ambulance. From there, it was just a matter of minutes until they had their flight clearance. And really within 30 minutes, I was touched down at the partner hospital. I was met there immediately by the stroke team, which included the emergency physician and the stroke neurologist. I feel very grateful because no matter where I was in the United States, I could not have had a better, more efficient diagnosis and appropriate transfer to a facility that was a stroke position that was best for my particular care. It was exceptional.
Yeah, so Dr. Thornbury was transferred after he received thrombolytic at TJ Sampson, and he was brought here at the time for consideration of a mechanical thrombectomy. The concern was that he might have an occlusion, a blockage in an artery in his brain that was causing the symptoms he had. And so he came here, was flown here, and he came through our ER to make sure that he was no longer needed that thrombectomy, which fortunately he did not, because he had improved so dramatically by the time he arrived to our ER. I think their swift response and workup they did was phenomenal. I remember being at the bedside with him, and he was doing so well that, it's not often that you're in the ICU and your patient is standing up next to you. And he was standing with me at the bedside, looking at the computer screen, looking at his carotid arteries and his CTA, and, having a very high level conversation with him, since he sort of understood, from a medical standpoint, exactly what I was talking about when I was pointing it out. So that'll be an encounter that I think I'll never forget. But I was also glad we could sort of get to the bottom of it for him. Trust in your local hospitals, your local facilities. I would say to always make sure to go to the nearest ED when you're experiencing stroke symptoms. It really is a helpful first step, and the correct treatments can at least be going ahead and be started, such that if there are higher level of care needs, at least the initial steps are undertaken to already put you in the best position to have a good outcome.
When you're looking at a rural facility, you're looking at specialties, you're looking at access to resources. It can be difficult to get those resources for your community. So having a partnership with a facility like TriStar that has already had those implemented, sustained for a long time, gives us the capability to provide that care and that medical service to our patients. TriStar has come in and done those live classes with all of our inpatient nurses, went through them with ED nursing. Those truly build that connection so we also know how to communicate well with each other.
I think, especially with hospitals like TJ, obviously we do some education. We go up and give talks to them on a semi-regular basis. I was up there and recently gave a talk about updates and management of emergent care for acute stroke.
Definitely shines a light on the fact that our focus is and will always be the patient at the center of every encounter that we serve and every decision we make.
And I think the take home was I got exceptional treatment not because I was the doctor, but because I was the patient. And because I was the patient and because those systems and those professionals were in place, I had the opportunity that I have now to come and help other people and the many, many other families that will come behind me that will have these same symptoms.